Hey, we want to welcome you again to another episode of the VET S.O.S. Veteran Entrepreneur Spotlight. Man, that's a mouthful. So remember, don't drown in the sea of transition. Grab the VET S.O.S. Lifeline. So the Veteran Entrepreneurship Spotlight is brought to you by. Is proud to be affiliated with the Neil Haley Show and sponsored by Spirit Point Solutions. So Spirit Point Solutions is the one-stop shop for leading edge products, services, and training from multiple vendors. That's from your AI training to your corporate gifts and much, much more. They have everything you need to help your organization thrive in a modern economy. So check out the valuable offerings at spearpointonline.com. Let's say that one more time, spearpointonline.com. And remember to use our code VET S.O.S. on anything that you purchase there. That will help us continue our mission, improving the lives of those who have served. So, our guest today is Miss Sepi Browning. She is a U.S. Army veteran and seasoned healthcare leader with over 20 years of experience in health IT, operations, and public health strategy. She is the founder and CEO of Brighthour Consulting Corporation, a women and veteran-owned firm specializing in digital transformation and workflow optimization across healthcare systems. Sebi has founded a Brighthour Foundation, a 501c3 nonprofit dedicated to providing scholarships and mentorships for students pursuing careers in healthcare and health IT. She's a passionate advocate for workforce development. She serves on several nonprofit boards and frequently speaks on leadership, innovation, and veteran transition. Her work bridges clinical insight, technical strategy, creating solutions that empower people and improve systems. Sepi brings heart, grit, and relentless focus on impact to everything she does. So please help me welcome Miss Sepi Browning. Thank you for coming on, Miss Sepi.
Woohoo! Thank you for having me. What an honor. Thank you so much. Now, I guess that was it. Enough, right? We're done. Close the shop. Go home. What an
Yes.
intro. That was very kind of you.
Thank you. Thank you. How you doing today? Everything well?
I am doing wonderful. Thank you. It's a great day to be alive. I'm very honored to join you today and learn more about the organization. I'm extremely happy to be joining you today.
Thank you so much. Thank you so much. So I want to hop right into the interview.
Yeah.
So looking back on it, and
Mhm.
I don't know how long it's been, but looking back on your transition,
Long
what would you
time.
say would be the three biggest lessons you learned in your transition from the military life to civilian life? And then also, how did it shape, how those lessons learned shape you today?
Well, I think those top three lessons are connecting, connecting, connecting. I know it
Okay.
sounds repetitive. I know it sounds basic, but really taking the opportunity to connect with people, network, and build
Mhm.
those relationships, I think are very, very valuable in
Okay.
what we do and how it can positively influence your transition. And also, you can continue to feel valuable. You will bring value to other people as well, but you never know until you create those relationships and build upon them. It is so hard to initiate, especially when you might be coming out of something you know,
Hmm.
and that environment, that ecosystem of being in the military to the civilian side is very different. Even when I worked in the bricks and mortars of a hospital in the Army
Yeah.
versus the bricks and mortars of a hospital on the civilian side,
Okay.
there are still a lot of variations.
Got you. Got you. So now you talk about working in those bricks and mortars in the army and in the civilian life. So I want you to take me back to the moment that entrepreneur bug sparked inside of you. So what was actually going on at the time that you decided to, hey, you know what I'm saying, I want to go on this entrepreneurship journey rather than just staying in that same safe job that you have as a healthcare provider?
It was a little after I had joined, I shouldn't say joined, after I transitioned to the civilian side,
Okay.
and you start formulating in your mind and understanding all the variabilities.
Mm,
You now have that what you compare everything to on that military workflow. And my husband is prior Army military infantry as well. So a lot
okay.
of those conversations were naturally occurring in our home.
Hmm.
And so you compare everything back to that.
Okay.
And as I was conducting my new front facing a career on the civilian side, trying to reestablish myself because in the late 1990s, a lot of one's military experience did not always carry that much weight.
Mm,
Even though you're like, I did this, or I had this exposure, this experience, this is what I'm bringing to the table. It really was not panning out in that viewpoint for those civilian decision makers. So, again, when you find yourself in those opportunities and um, have that vision,
mhm,
I think that kind of became a natural next step is to be able to identify what all the benefits and what all the opportunities are from all those worlds and bring it together and be able to offer solutions, offer perspective, and be a part of it at a table. I'm not saying any one person, not me ever, can resolve or solve all that by myself, but
mhm,
being an entrepreneur or trying to be a part of that world as well often might offer an opportunity to be sitting at that table with those right people and try to, make some improvements, make or be part of that solution in whatever you're doing. Healthcare has always been the core of what I did. I started off as a medic, EMT, LPN, in the
mhm.
Army, and then worked my way through, got my commission in the medical service corps and transition over to this, like we just said, the civilian side. So healthcare has always been the core of my values and my mission and what I believed in doing. Um, that entrepreneurship just took it to that other next level of being able to solution more with
Mm,
all variety of roles and departments in our healthcare ecosystem.
got you. So now that you're in the thick of it, I mean, the thick of the entrepreneurship journey, I mean, what's been the most rewarding part of it? That's my first part of my question. And the second part of my question is, what lights you up every morning that you wake up?
I think one of the best parts of having an entrepreneur role or
Hmm.
even just the mentality of it it does offer some freedom and
Hmm.
fulfillment and lets you find ways to always align what you're doing with your values every day and continue to create those opportunities, not just for yourself but everyone around you and where you can find to be impactful. I think that's one of the wonderful, wonderful opportunities there. And what gets me going every morning in
Hmm.
this ever changing world of healthcare and
Mm.
every component of healthcare from the beginning to the end of the workflow, whether you're doing billing, whether you're doing actual bedside patient care or leadership, all the components touch some level of technology. And just like anything in this world that we're in right now, it's ever changing with technology. And being able to be a small piece of that
Hmm.
is something that I truly value and enjoy being a part of. So it's just at this point, I believe it's in my blood.
Got you. So now we know that being an entrepreneur is not always sunshine and rainbows. It's not always that easy. So what's been the hardest or most frustrating part about being an entrepreneur? And to add on to that, how did you deal with it?
Yeah, I think anytime you're doing something for yourself or initiating something, creating something, even if you're gardening, right? Or
Hmm.
anything you're doing, you're kind of growing it from the ground up. And so it can be a little painful or it can be slow at times, and you got to continue to nurture it for you to see that success. And I think at times you find yourself wearing a lot of hats and conflicting priorities, and it can be overwhelming at times because success might not be as quickly visible to oneself or even out in the community where you're trying to collaborate or partner with others,
Hmm.
and where you believe you can bring value. So often, you find yourself in those positions where you are really working hard to illustrate the value you believe in your heart that you can and would bring. But day in and day out, it's that, again, back to that military mentality. You do not give up.
Mm-hmm.
You're not going to hang it up and just walk away.
Yes.
You will continue to work hard through whatever those challenges are, identify your lessons learned, figure out what you need to do. You might have to step back and reassess to continue to move forward, but you do that. There is no other option that you want to offer to yourself, right? And you
Yeah.
believe and would want to believe that if you're doing that, hopefully you're setting example, for whether it's your own children or with others in your network that are trying to work their way into your profession, you would love to believe that you can set some positive examples there.
Okay. And so did you take advantage of any of the business or veteran programs, mentors, any communities that you to help launch a business?
Yeah. So I'll be honest. Initially, I did not. I did
Oh, really?
not
Wow.
know about a lot of them.
Mm,
As throughout the years, I was through one thing I did know was networking, is connecting with people, and people started informing me, educating me, sharing knowledge with me, and sharing these opportunities that you're talking about. Whether it's your local chambers, right, or
mm-hmm.
the organization VET S.O.S.
Yes.
And wherever you live, there are a variety of different organizations that can bring that value. And some of the tools that we have today, I know social media has a lot of different perspectives, but taking LinkedIn or taking some of our platforms and just searching for these different groups is much simpler now, and I'm hoping that everyone takes the time to take advantage of some of the tools we have at our fingertips and finding like-minded organizations, like you mentioned. Whether nowadays there are a lot of big companies that offer small business workshops more often than before.
Mm-hmm.
And there's a lot of different ways to get leadership experience or technology experience or certifications. There's a lot of free complimentary opportunities out there. And I
Mm-hmm.
think maybe at times it can be overwhelming because there's a lot now. But I do think, again, going back to networking and communicating and connecting with the people in the ecosystem that you want to be in and get some feedback on what they're seeing working or maybe what they have positively experienced might help one focus on what might be a good next step for themselves to consider.
Okay. Makes sense. So tell us about your business, Bright Hour Hit Consulting. I mean, what
Yeah,
exactly do you do? Who do you serve? And what makes your
yeah.
company different than those that are out there now?
Yeah, absolutely. As you mentioned, which thank you for doing, is that we are a healthcare IT consulting company. We're veteran-owned, women-owned, small business, and we really work to bring value around uh, digital transformation, around workflow enhancements. We bring a lot of value and experience, not only, as we mentioned a couple times, in hospitals, but also in the public health arena. We really want and work towards being a partner to anyone we're working with so we can help you through any of the challenges and leave you in a better situation, in a better outcome as we transition on and leave you to be continue to be successful in your department, in your organization. We really work on digital solutions and building a strong foundation that is sustainable
Mm-hmm.
and operational. We do not want to come in and make some magical changes that is not realistic for what you're trying to do, and it's not something your team is able to sustain because ultimately we want to make sure you are successful and remain successful in everything that you do. And whether it's working with your team to deploy a out of the box solution, or
Mm-hmm.
sometimes based on the needs of your team, your department, or your state, because we work with a lot of public health at the state level. It
Mm-hmm.
might be something custom that you need developed so that it best needs. Sometimes doing custom, again, based on the needs, might
Mm-hmm.
offer some flexibility to some smaller rural entities that where money might not be there for them to purchase an expensive out of the box type of solution. So we're there to really help you think through all of that and
Mm-hmm.
really identify a solution that is best for what you're doing and your organization. Um, just really help think through the pros and cons
Yeah.
with that experience we've had throughout the years.
Okay. Sounds great. So where, if somebody wanted to learn more, connect with you, where should they go?
Um, I'm very active on LinkedIn. So if you were to find me on LinkedIn, Sepi Browning, that's a wonderful way to connect. And I'm always very honored to connect with any of my peers and people in our ecosystem. Our website is brighthour.net. And on there, we share a little bit about our services and also continue to build out and illustrate really where our heart and mission continues to go, which is a lot with our foundation, as you mentioned, where we're really focusing on the next generation of our industry. And we're really working hard, coming together with a lot of people that are in my network that are amazing people that are giving their support and time in making this foundation what it has become and will continue to be, where we're really focusing on student scholarships, just
Mm-hmm.
ways to help support the future of our industry, whether you're a nurse, whether you're someone in the financial business side or on the healthcare IT side. Anyone working on their AA, associate's degree to their PhD, we're here. We want to find ways to just complement. Again, we're not going to solve every issue there is out there. We're very small. The foundation is only 6 months old, so it's fresh off
Mm-hmm.
the press and something we're really working hard to get the message out there.
Mm-hmm.
But it's really something from the heart, from the soul, and we got some great people working to bring that to the forefront and as an opportunity to continue to partner with other nonprofit organizations and just find ways where collectively all of us seasoned professionals hopefully can bring some value and some um, um, like you said, there's so many resources out there. Do people
Yeah.
know?
Yeah.
How do we get the message out there of what is
Mm-hmm.
out there? And then sometimes it's overwhelming. How do they focus on what might be best for them at this point in their journey?
Got you. Got you. Well, thank you so much, Miss Seppi, for joining us. As she said, connect with Sepi Browning on LinkedIn. Please go out, connect with her, help her foundation. She just got started. Let's try to get more people involved and get the word out on what she's doing in the healthcare industry. So, as I said again, thank you, Ms. Sepi, for joining us on the VET S.O.S. podcast. On behalf of the VET S.O.S. family, we'd like to thank all of our listeners out there joining us today. You can find the VET S.O.S. podcast on your favorite podcast platforms. You can find us on YouTube and all the social media platforms. Make sure you subscribe and follow VET S.O.S. on all of our social media platforms so you don't miss anything. Remember, don't drown in a sea of transition. Grab the VET S.O.S. lifeline.
Right. And thank you to our sponsors.